Welcome back. Welcome back, everyone. Welcome. Surprise, I'm going live. It's been 9 weeks since we did any live recording. As you can see by the title, we're going to be talking about the FDA's latest warning when it comes to RF microneedling. If you're new here, welcome. I'm Dr. Kimberly Madison, a doctorally prepared nurse practitioner and the founder of Mahogany Dermatology Nursing Education and Research, where we're committed to increasing access to dermatology education, specifically when it comes to skin of color, business acumen, and digital fluency. Before we get started, let's do some technical checking here. When you join me, please say hi in the comments. I'm so excited. It's been so long. And we just want to make sure you can see me and hear me. But like I said, we're going to be talking about the FDA warning that every aesthetic NP needs to know. That was released on October 15th of this year, 2025, depending on when you're watching this. And it affects how you practice. If you perform or refer patients for RF microneedling, and if you're thinking this doesn't apply to me, hold on, because your patients are calling, or they will be calling, whether you offer this service or not. You need to know how to respond. Tonight, I'm going to break down exactly what this FDA warning means, what you need to do today to protect your practice, and the specific conversations you need to have with your patients. This is not just clinical information. This is about protecting your license, your reputation, and of course, your business. So let's do our check real quick. Make sure you can see me and hear me. And I'll be back this weekend. I don't know when exactly. So you can join me then too. And actually, let's see. Okay, great. Like I said, I'm Kimberly. I've been coming on YouTube almost 2 years now. I just thought about that. And I do live recordings, but the videos come out every Friday at 11 a.m. Central Time, so I can join you during your lunch break. But I do the live recording whenever I have time. So if you're subscribed, you'll get notified immediately when that happens, and you can join me, and I can answer your questions in real time. So we're going to get into this. Before we get started, we're going to do two things. We're going to do our prayer, which we do every week. And I just want to make sure you can see me and hear me. Okay, I'm just checking the mic because I have done these before and then actually, you know what? The microphone is not moving. So let's see. Testing. Oh, you can hear me. Okay, great. Okay, so our prayer is, Jesus, thank you for modeling how to live a God-honoring life. I know I mess up sometimes, but I also know that with your guidance, I can learn to become more like you. I believe in you, Jesus. Help me to live what I speak and to follow your example each day. Amen. And before I forget, because I know I'm probably just going to have a hard stop after this, I just want to thank you. I made my first sale in the UK, which I've had a lot of connections with the UK. I feel like that's a sign that I'll be heading over there. Well, actually, I am heading over there. I'm going to Italy. I'm going to Italy next year. That's for vacation, although maybe it might turn into business. But last weekend was the Beauty Beat, which is the UK's luxury beauty event for women of color. And it was wonderful. So it was in-person event, but then they also aired it for free online. And if you missed it, that's okay, because they're going to be posting it to their YouTube channel soon. And if you're subscribed to our email list, you'll get notified when that happens. Or you can just follow them on social media also. But anyway, I just want to thank, I made my first sale of Nursing Aesthetics, an introductory guide for nurse practitioners and entrepreneurs in the UK. I'm thinking about doing like a signed giveaway. If you are interested or think that's a good idea, let me know in the comments. And in one of my videos this weekend, I'll let you know what I've decided and how you can participate. Okay, so let me see, is there anything else? Like I said, I'll probably be doing batch content this weekend. I did the 8 before, and I would love to do that again. And so I'll probably do enough videos to finish me out for the rest of the year. I'd love for you to join me. I already have a list of ideas, but if you have some, please let me know. This is still a space where I am here to help you with your problems. And that's where all these questions, that's where all these videos come from. That's where everything that we're doing over here comes from. So like I said, I'm the founder of Mahogany Dermatology Nursing Education and Research. We achieve our missions through two divisions. The first is the Melanin Initiative podcast, which is a health literacy podcast. We elevate the expertise of nurses, bring awareness to diverse career opportunities in the healthcare industry, and then we share with our peers all the ways that you can leverage your expertise, both as clinicians caring for patients, but also as entrepreneurs. Let's see, at the time that I'm recording this, we just aired our first episode with the space nurse. And then this weekend, we'll be releasing an episode on perimenopause, a very popular topic these days. And by the way, we dropped an article on the blog yesterday, the Mahogany Dermatology blog. If you never thought about the relationship between dermatology and space medicine, then you might be really delighted by this article, which talks about the challenge that astronauts face in washing their hair when they're in outer space or in a microgravity environment, and how that affects how they carry their products, how they apply them, and whether they can actually achieve their goal. But one thing that's really great about microgravity is because things deteriorate so quickly, muscle, bone, skin turnover, there's a well, actually not turnover. There's a chance that hold on. Oh, somebody's here. Hi, say hello. Okay, some things change, something never changes the same. Um, because things change so quickly out there, they're really great environment to teach us things here on Earth, so we can learn things in a lot faster pace, and vice versa. The things that we're learning here, we can try to apply in space, and so it's really interesting, really fascinating. Shout out to Christine Rincon for that. So microneedling. First, let's talk about what it is. So it stands for radio frequency microneedling. So this is a minimally invasive aesthetic procedure that I've done and look forward to doing again. Highly recommend it. It's great for skin of color, microneedling in particular. And it combines two treatment methods. So you have your traditional microneedling and radio frequency energy, tiny needles that create controlled microinjuries in the skin. This is the microneedling component, the part that I'm talking about that I love, that's safe for skin of color. It stimulates the body's natural wound healing response and collagen production, which decreases as we age. So, when we talk about aging, I think because of marketing and the messaging that's out there, it's always tied to wrinkles and light skin. But as you get into diverse skin tones, aging has a different connotation. You have to also ask the person individually, but there's culture. So I know in my community, we don't really think of, some people frame aging as a bad thing, but some people don't see aging as a bad thing. So if you're using that to say, hey, I'm going to solve this problem, and I think your problem is aging, but I don't think aging is a problem, then you miss me completely. So you really have to think about what is changing with time, right? As we age, that I might see as a problem or that I might want to correct or fix. So if you're out there, you're a cosmetic nurse practitioner, you're doing your marketing and your sales, and you're trying to think about how you can reach your target audience or how you can expand your target audience, then you want to use the words they're using. Okay, so anyway, collagen production decreases with age. Simultaneously, the needles deliver this radio frequency energy deep into the dermis. This heat energy tightens existing collagen and triggers further new collagen and elastin production, offering a deeper and often more dramatic results for skin tightening, scar revision, and texture improvement than traditional needling alone. Now, I got great results with just traditional needling, and that's what I plan to do again. Now, let's talk about how FDA regulations work for these devices. Now, most aesthetic devices like RF microneedling machines are considered Class 2 medical devices by the FDA. They're typically brought to market through what's called a 510K pre-market notification process. This means the manufacturer must demonstrate that their new device is substantially equivalent in safety and effectiveness to a device already legally marketed, what they call a predicate device. Now, it's important to understand this is clearance, not approval. So the FDA does not necessarily perform clinical trials on the device itself. Under 510K, the agency relies on post-marketing surveillance. tracking adverse events reports to monitor safety after the device is in widespread use. The safety communication we're discussing today is a direct result of the FDA's adverse event monitoring system, which flags significant complications. 5 things you're going to learn: what they said exactly, why this matters for your practice, the patient conversations you'll have, updating your informed consent and documentation, and how to turn this into a business opportunity. Yes, there is a strategic angle here. And okay, so we did. Okay, so on October 15th of 2025, the FDA issued a safety communication about radio frequency microneedling devices. Now, before you panic, this is not a ban. So RF microneedling is still very much legal, still FDA cleared, but the FDA is investigating serious complications. And here's what they're saying. Number one, burns and thermal injuries. So we're not talking about mild redness, we're talking about actual burns that require medical intervention. The second is permanent scarring. These are the things they're investigating. Patients go in for anti-aging treatments and coming out with disfigurement. Number third, reports of fat loss and tissue atrophy. This is particularly concerning because it's not always immediately visible. Patients might not realize it for months, actually. The fourth one, nerve damage. This can present as numbness, tingling, or changes in sensation that may be permanent. The need for surgical repair. Some of these complications have been so severe that patients have needed reconstruction. Now, again, I want to be very clear that RF microneedling devices are Class 2 medical devices. They have been cleared by FDA through that 510 process. So what's changed? Well, the FDA is now seeing enough adverse events to report that they felt compelled to issue this public communication. What you need to understand is that the FDA is saying we're investigating, and in the meantime, everyone needs to be more careful. When the FDA does this, it's not just a suggestion, it's a signal that the regulatory market landscape is shifting. Keyword mentioned for your algorithm. This is similar to what we've seen with other aesthetic devices. One example is cool sculpting, where the FDA eventually added stronger warnings, right? You have some content creators out there who have been covering these device safety extensively, like Dr. Dustin Portella and Dr. Sam Ellis. And this RF microneedling situation is something every cosmetic NP, especially if you're an entrepreneur, needs to be aware of because you have so much to protect. And so why does this matter for your practice? Now, I know some of you are saying maybe you don't perform microneedling, and why should you care? And this is why you should care, because we're going to go over these reasons, but also anytime you see me talking to you, giving you information, it's not just, I'm not here to help you just do the one thing, take care of the patient, be a great injector. I'm here to help you create your own lane so that you can not only help elevate our practice as nurse practitioners, right? All of us have to play a role for that to happen, but that so you can get paid for multiple things. This is all about financial literacy, so you can do what you want, when you want, with the people you want to do it, where you want to do it. Generational wealth, dynastic wealth. There's not enough hours in the day to make enough money to really live off of. And so that means your money needs to work for you. It needs to work for you when you're asleep. And so you have to work your way out of a job so you can experience that freedom that we talked about. Even the freedom for you might still be seeing patients, might still be doing this thing, but it'll be on your own terms when you want to, not because you have to. So when I'm giving you this information, even if you don't own your own business, even if you work for someone else, even if you're not maybe you haven't even finished NP school yet, I want you to be seen. I want nurses and nurse practitioners to be seen as key authorities. We're already trusted, but when people come to you and they trust you, I want you to have the information to be able to communicate it with confidence and for people to recognize that we have value to offer, right? We can contribute to the discourse, the conversation, the business, the creation, the innovation, the policy. We can do that. And so you need to see yourself as being more than just whatever you fill the blank in, right? I still heard someone this week say, just the nurse. You have to get rid of that. That mindset, that mind shift is number one. Until that happens, nothing else can happen. Your mind shift, your mindset, your relationship with money, your time management, what you believe is possible, believing in abundance, living in abundance, an abundance mindset. All of those things are directly tied to the success of your business. The more you see people climb in success and achievement, including wealth, you see them invest a lot in being able to have as much control of their mind as possible, whether that's setting boundaries or actually real control. People are out here doing, oh man, what's that stuff called? Like biofeedback. Like they really want real control, and they're investing a lot of money, not just to hope. Like so many of you use the word hope. I hope it works out. I hope this happens. They're not hoping when they're spending tens of millions of dollars. They're getting as close to guarantee as you can get. So, I always go off on these. It's been a long time. So I always have to go back over these little why we're doing all of this, why we're showing up, why I show up every day, and to make sure that we're all on the same page about what it is we're actually doing. I meet people who want to go into nursing all the time, and I ask them, what is the goal? Everyone always starts talking about the patient or some degree they're getting, but the goal is usually outside of that. It's much bigger than that. And so there's a million ways to get to your goal. Let's figure out what the best one is for you. It may or may not be nursing, cosmetics, or business, but we won't know that until we identify where you're trying to go. And because the goalpost is always moving, you want to get into school, you want to graduate, you want to pass boards, you want to get a job, you want to get a new job, you want to get paid higher, you want to switch specialties. That goalpost, the thing you want, is always moving. So how do you know when you can stop? Because you can stop one day and stop working and do something else. That is an option too. Okay, let's get back to it. So patients are going to call. So this is why you need to know, so you can be informed and not just pass on the buck. So number one, they saw the FDA warning on social media, on the news, in their group chat, in Reddit, and they're calling your office, asking you questions. If the front desk doesn't know how to respond, you're going to have a problem. Number two, you might refer patients. If you've ever said, I don't do RF microneedling here, but check out this med spa or this directory, now you're part of the conversation. If that patient has complications, do you think they're not going to mention that you referred them? Number three, informed consent liability. If you do perform RF microneedling and you haven't updated your consent form since October 15th, you're practicing with insufficient informed consent. That's a malpractice lawsuit waiting to happen. Number four, this is a pattern. First, it was filler complications, and it was PDO threads. Now it's RF microneedling. This shows you that the FDA is, and we see this in the group chat, that the FDA is paying more attention to aesthetic devices. And so you need to stay ahead of the curve and, stay ready so you don't have to get ready. And it decreases the fear, right? Remember when you used to work in the hospital and was it state? When the state comes around, everyone freaks out. They want to start following the protocol. Well, if you always follow the protocol, you don't have to freak out, right? Number five, your competitors are watching. If you handle this well, and not just your competitors, the people you're training, people on social media. Remember, all of us are always precepting or mentoring someone. Someone's always watching you. If you just need to live a life like somebody's always watching you. So update your protocols, educate your patients, be very transparent. This builds trust. And if you don't know it yet and you still need to figure it out and your client brings it up, be honest about that too. I learn from my patients every day. If you handle it poorly or you ignore it, which is probably the worst thing, your patients are going to notice they're going to go elsewhere. Let me tell you what I've seen already since this announcement came out. Practices are scrambling, just like we saw in facilities when state comes around, because they weren't prepared. One NP told me that her receptionist minimized the patient's concern and said, I'm sure you're fine, when the patient called worried about nerve damage. We have all seen this in our practice. Wherever you've worked, we've all heard patients address a concern, and sometimes we have minimized their concern because we see problems all the time. We become desensitized to them. And so, unfortunately, that patient is now threatening to report them for negligence. But all of this is preventable. Just like our patients, we don't want you to be scared. We want you to be informed. And when you're informed, that usually increases your confidence. And when we give you scripts, it tells you exactly how to respond. But that's only if you take action, which is a great time to say, if you're here and you're not already subscribed, I'd love for you to take action in the comments or by hitting subscribe so that you can be notified next time I go live. And, I can answer your questions right now too. And you don't have to wait for a calendar invite or for me to respond to your email. The whole benefit of this is open office hours. That's my dream, office hours. And so I haven't mentioned that dream in a while, but my dream is to have like regular open office hours like this virtually with like a nursing school or some kind of mentorship group. it would be nice if they're students and they already know they want to do nursing, or maybe they're like in some kind of health track and they're thinking about nursing. Um, so yeah, that's what I would love. And so ask and ye shall receive. So let's do some scenarios that you might encounter and what you can actually say about it so you can feel more confident. So number one, your patient wants to schedule RF microneedling. They call your office ready to book, and what you're going to say or what your staff can say. I'd be happy to help you schedule a consultation. Before we proceed with RF microneedling, I need to let you know that the FDA recently issued a safety alert about this procedure. Our provider will discuss this with you along with alternative options. Would you like to schedule a consultation first? The key here is you don't schedule treatment directly. Schedule a consultation where you have the informed consent conversation face to face or virtually. Number two, the patient had microneedling already, RF microneedling, and they have no concerns. I had this done last month and saw the FDA warning. Should I be worried? Your response is, thank you so much for calling. Many patients have good outcomes, but we want to make sure you're doing well. You're experiencing unusual symptoms like burning, pain, changes in your skin texture, numbness, or scarring. If not, continue to monitor and call us immediately if anything changes. Now, if you don't have like an emergency number, then you want to refer them appropriately so they know. Document this call, right? If you don't document, it doesn't happen. Document that you ask screening questions and document their response. Another situation, your patient had microneedling, RF microneedling, and now they have concerns. So this is urgent. You're going to transfer them to clinical staff immediately or schedule the same day evaluation. Don't minimize this. Don't say that's normal. Make sure they're seen by you or someone who's available. Number four, the patient saw the FDA warning and wants to know if it's safe. Acknowledge the warning, explain what the FDA is investigating, discuss risk and benefits. We always do this. This is not outside of our own practice. This is what we do all the time. And we also offer alternatives. We always want to give people all the options so they're well informed. People who are well informed make better decisions. Let me make an informed decision for them, help them make an informed decision. Number five, the patient had the procedure elsewhere and now they're asking you for help. You can schedule them for an evaluation, get records from the other facility if that's possible, and we don't criticize our peers. That doesn't help anyone, right? Just focus on helping the patient. For more detailed scripts and SOPs, which we've been offering our members of the Alliance of Cosmetic Nurse Practitioners, so we gave them some SOPs, we gave them some scripts, staff training guides. That's all one of the benefits of being a member. And we do have the link in the description box. The doors will open soon for membership. You can welcome to join the waitlist. Okay, so let's talk about legal protection, right? So your informed consent form must be updated. Here's what needs to be added. Number one, refer to the October 15th FDA safety communication. Specific date matters. You can just Google and you can get all the information from their website. Number two, specific listing of the complications: burns, scarring, fat loss, disfigurement, nerve damage. Don't use vague language like possible complications. Be very explicit and don't rush your client through reading that consent. Number three, statement that the FDA evaluation is still ongoing. This shows you being transparent about evolving information. Number four, patient acknowledgement that complications may require surgical repair. They need to understand this isn't just a little downtime. Excuse me. Documentation that alternative treatments are discussed or were discussed. List them: traditional microneedling, chemical peels, laser treatments, topical retinoids. Here's a sample you can say. You can say, look, I have been informed of the FDA safety communication dated October 15th, 2025, regarding serious complications with RF microneedling devices, including burns, scarring, fat loss, disfigurement, nerve damage. I understand that some patients have required surgical repair or medical intervention to treat injuries from this procedure. I have discussed alternative treatment options with my provider, including, and can list the alternatives that you offered or that you recommended, and have had all my questions answered. Now, beyond that consent form, you need to document in every patient chart when you discuss the FDA warning. Document it when a patient asks about RF microneedling. Document it when someone calls about concerns. Document it. You already know documentation is your legal protection. If you don't document it, it didn't happen. Now let's talk about how you can turn this into a business opportunity. And this is where most of our colleagues miss the opportunity, right? Because remember, you got to always step away from what you do, taking care of the patient, and think a little bit bigger. Now, when an FDA warning comes out, most providers panic, but strategic NPs like you see this as a chance to differentiate and build trust. There's always a way to stand out in a saturated market. You're going to position yourself as the informed safety provider first. That's how I started this conversation today. I want you to be able to sit at any table and have any conversation. Even if you're not the most experienced or you don't have all the information, I want you to be comfortable enough to have the conversation, to engage, to offer your thought leadership, to be able to ask really good questions. Even if that's all you do is ask really good questions, that is enough. That's enough. You're enough. It's good enough. You can send an email to your patient first, post on social media, say, we want to make sure you're aware of this FDA communication. That's something you can even do after you watch this video or while you're still watching. Your safety is our priority. Here's what we're doing to ensure the highest standards. Everybody loves that. It builds trust because they're already hearing it. It's just like your kids. You think they're not hearing stuff just because you're not talking about it. If they walk out the door, you don't have any control over that. Assume that they're getting that information from somebody. You want it to be from you. Patients remember who communicates proactively. Number 2, offering alternatives and education, right? Keep them in the loop. If patients are scared of RF microneedling, now what are they good candidates for? Create content around alternatives. This is a wonderful time to do that. Position yourself as the expert who helps them navigate options. Because when you say no, they're going to go find someone who says yes. Evaluate your service mix. If RF microneedling is RF microneedling a significant revenue driver for you? Or could you pivot to other modalities that have better safety profiles and still achieve patient goals? Even if you don't do RF microneedling, this thought process, this evaluation of your business and your services, you should always do this. This is just a kind of a reminder like, oh, yeah, it's always good to take a look at some other things. Maybe that's where the tiers come in. You have your platinum packages, right? That's what you really want to sell. But you know that everyone who's in your customer journey isn't ready for that, but they are ready for something. So you always want to come downstream and figure out what you can offer them: platinum, gold, silver, bronze, and then prepare them to be that next client so you can actually eventually sell that platinum service. So run your numbers. Sometimes removing a service as high risk, like RF microneedling, and moderate revenue makes business sense. Number 4, wonderful opportunity for staff training, yours and other people. This is a teaching moment. How your team handles this situation reveals gaps in your protocol. You can fix those right now before the next FDA alert drops, right? Because it will happen again. And whatever you come up with, you can always pitch this to other businesses. Whatever problem you have, there's 1,000 other businesses that have the same problem, and they'd be willing to pay you to solve their problem because time and capital are limited. I don't have time to solve all my problems. Sometimes I have to get other people to help me who do this every single day. Build your thought leadership, right? Create content around this. Talk about talk about safety, and you might even get invited to speak on a stage somewhere that has nothing to do with nursing. Educate your audience. This is how you build authority in the market. This is how you create your own lane and become a key authority in dermatology. And speaking of thought leadership, which you know is my absolute favorite thing for you, that's why I always recommend my favorite book. If you know it, you can put it in the comments. Key Person of Influence by Daniel Priestley. You can watch there's an audiobook too that's really great. If you want to build a brand that positions you as the go-to expert in your market, that's exactly what we do every week in the Alliance. I also offer strategic advisory sessions. We work one-on-one and build your business strategy, your clinical protocols, your marketing, growth strategy, social media, you name it. Whatever your goals is, we create a plan that's personalized to help you achieve those goals within a set time frame, right? We're here to get things done. That link is in the description box if you're interested in Mahogany Dermatology Consulting or if you want to come on over with us to the Alliance. So we're coming to the close of our video today. I want to hear from you in the comments. Let me know if you have more questions about RF microneedling, FDA regulations, or updating your protocols. And what you've learned, we'd love to learn together. Certainly, you can share that. We'd love to hear that. If you want to write an article on the blog on advice on how to navigate this, also welcome to contribute. And so the kind of one of the takeaways here is that FDA RF microneedling warning is not just a clinical update. It's a business and legal issue that requires immediate action. And you're well equipped to handle this, right? We do hard things all the time. This isn't the last time. This isn't the first time, and it won't be the last time. Again, update your informed consent, train your staff, document everything. You are used to doing this. And if you do this the right way, you don't just protect yourself from liability, you build trust with your patients and you differentiate yourself from the market, and prefer, especially people who aren't paying it any attention. The most successful entrepreneurs aren't just great clinicians. We're strategic business owners who stay ahead of regulatory changes and position ourselves as leaders in the field. That's what I teach, that's what I do, and that's what I want for you. If you found this helpful and you feel more confident about handling this FDA warning in your practice, the next thing you can do is join the waitlist for the Alliance, where they've already received, like I think 2 weeks ago, a full breakdown of the FDA communication, sample patient scripts for the different scenarios that we discussed, updated informed consent language, documentation templates, staff training checklists, adverse event reporting procedures, and information that they can actually just put right there on their desk and make it easy so when someone calls, the staff knows how to respond with confidence. If you're serious about building a business on the side or your own empire and protecting your assets, then we want you to join the Alliance. We are a professional membership for nurse practitioners who specialize in cosmetics and entrepreneurship, who want to build a business on the side or build your own empire. We pick up where your on demand, weekend training, or academic course leaves off because we know that your first question is never your last question. And when you go to nursing school, we all know there's no skin of color. When you go to dermatology training, there's no entrepreneurship. And when you go to cosmetics, they don't talk about advanced practice nursing. But that's you. And so the Alliance is there to address all three gaps. And we continue to connect you with resources and communities that are out here helping you reach your goals, not only as a clinician, but also as an entrepreneur. And like I said, the doors will open soon. You can find these videos every Friday at 11 a.m. Central on YouTube and now LinkedIn. Be happy to meet you over there. And I will see you next time. I thank you all for watching. I've missed you so much. And I look forward to talking more about to my friends in the UK soon. And oh, did I already mention? Yeah, I told you about the beauty beat. So yeah, stay out for that. Look out for that. I'll do a video upcoming soon about that and talk about ideas on how you can combine perhaps your love for the beauty industry and your love for your nursing practice and your business. Thank you all for watching. I'll see you next time.